To health care, where who should be eligible is the key question as the state proposes some major changes to BadgerCare.
Yeah, it's part of a $500 million in cuts required under the state budget. News 3's Jessica Arp explains.
The eligibility reforms themselves, we believe, are both reasonable and logical.
In a news conference Friday, the Department of Health Services Secretary rolled out millions of dollars in cuts to state Medicaid programs. A key to the plan, a waiver to the federal requirement that states continue their current levels of health care. The state is asking to take away eligibility for those who have access to employer-sponsored insurance, young people who can go on their parents' plans, and anyone not a state resident, among other changes. If the feds don't agree, the state says they will have to kick some 53,000 people off BadgerCare.
The federal government has said, state, yes, you can simply drop them. That is not what we want to do, and that is the importance that is attached to this waiver. Because if we do not receive the waiver, then I believe the state truly will be forced to make that decision.
They're creating a hostage situation for 53,000 adults in Wisconsin.
Executive Director for health advocacy group ABC for Health says the proposed changes simply shift the costs from the state to the private sector and put people in the middle.
This is moving in the wrong direction. It's pushing people to a private marketplace that doesn't exist. And if it does exist, it's high premiums, it's expensive care, it's large deductibles, and we don't know what they're going to be getting.
The 52-page proposal will need some aspects approved by the state, others by the federal government, but the state says they want to hear from the public.
We welcome the public debate that this will no doubt generate. We believe that our proposals themselves are fair, they are focused, and they're simply common sense things.
A public hearing has yet to be scheduled on the changes, but DHS says they need the waiver to be submitted and granted by the end of the year. There are many other changes, which include new medical homes for some service groups. We've put a link to the DHS plan on our website if you want to learn more. There's a lot more there to go through, too.
Some complicated stuff. Thanks so much, Jessica.